I'm really nervous to meet my nurse today.
I know, it's okay. I bet she's nice.
Yeah, I hope so. Come in.
Hi, my name is Tristan. I'll be your nurse today. Are you Sierra?
Yeah.
Nice to meet you.
Nice to
And
meet
you
you.
are?
Sarah, Sierra's sister.
Nice to meet you.
Nice to meet you.
What brings you in today?
I feel that my sister would be a lot more comfortable with a female nurse.
Okay, not a problem. I will go talk to my colleague and she'll be right in and take a look at you.
Thank you.
Hey Anna, would you mind going in and taking a look at my patient Sierra?
Oh,
She
yeah.
seems to be uncomfortable with male nurses treating her and would prefer a female nurse.
Okay, do you know where she's from?
Yeah, she says she's from the Marshall Islands.
Oh, okay. I've worked with patients from the Marshall Islands before. It's nothing against you. The Marshallese women are just very personal with their information and feel more comfortable with females. This could be why they requested a female nurse, but I'll go ahead and go speak to her.
Awesome, thank you so much.
You're welcome.
Come in.
Hi, are you Sierra?
Hi, yeah.
Hi, it's nice to meet you. My name's Anna. I'm going to be your nurse today.
Hi.
Hi.
Sarah's sister.
Oh, nice to meet you.
Nice to meet you.
All right, well, let me look at your chart. What is bringing you in today?
Well, I've been having trouble finding healthy foods to eat, and I've noticed a slight weight gain within the last year, so I'm kind of concerned.
Okay, do you mind if I take your blood glucose level?
Yeah,
real quick?
sure.
Okay, have you ever had that done before?
No, I haven't.
All right, so what it's going to do is I'm just going to prick your finger, and it's going to tell me right away what your blood glucose level is right now, and that's going to tell me some things about what's going on in your body just with regard to your current diet.
Okay.
All right, so once again, you're just going to feel a small prick. Okay, and it looks like you're at about 160 right now.
Okay.
Oh, sorry.
And, oh, you're fine. And that is a bit high. Normal glucose range is from 60 to 110.
Okay.
Let's see. Have you eaten recently?
I haven't eaten within the last few hours. No.
Okay. Can you go ahead and just describe to me what you eat in a normal day?
Yeah, well, back on the island, we didn't have very much access to healthy foods, so a lot of the time we ate processed and canned foods.
Okay.
And so growing up with this lifestyle, I've kind of kept it since I moved to America. So for breakfast, I usually have pancakes, and then for lunch and dinner, I usually have some sort of rice and canned meat meal.
Okay. Well, I understand that this can be very hard to break the eating habits that you grew up with since your childhood. Do you have any family history of illnesses?
Yeah, I believe there's diabetes in my family.
Okay. Do you know what kind of diabetes? There's type 1 or type 2?
I think it's type 2.
Okay. Do you know anything about type 2 diabetes?
No, I don't.
All right, so type 2 diabetes means that your pancreas is making enough insulin, which is good. But insulin allows your body to take up the glucose that you need when you eat food. And however, with type 2 diabetes, even though you're making enough insulin for your body, your cells aren't able to take in the glucose.
Right.
Over time, you will become insulin resistant, and that's the main issue in this disease. In the case of type 2 diabetes, your diet is extremely important in maintaining your health. The diet that you're currently on could be contributing to the development of diabetes, and with your family history, that also increases your risk. Would you like some resources to show you how to improve your diet?
Sure.
Yeah. Okay. I have some things up here. So this right here is a brochure with some signs and symptoms that go along with diabetes, just so that you're aware.
Okay.
And this is a low-carb diet. It tells you all the steps and information that you would need to follow, something like that. So I'll give you guys a couple minutes to talk about that, okay?
Okay.
I got the one inside.
Yeah.
What's the diet?
Okay.
All right. So did you have any questions after looking at those?
Yeah, so how does this diet help prevent diabetes?
Oh, good question. So a diet low in carbohydrates can reduce the amount of sugar that your body is taking in. So that is going to decrease your need for glucose. And it will also reduce your body's need to make insulin.
Okay. So what kind of foods go along with this diet?
It's going to include eggs, spinach, nuts, fresh meat, just things like that, really healthy choices. Do you have a store near you that has these sorts of foods?
Yeah, we actually have one right down the street from our house.
You're right.
Oh, okay, that's great. Like anything, the hardest part of making a change is taking the first step. But with you two supporting each other, I'm very confident that you'll be able to succeed in changing your diet.
Thanks, Anna.
You're
That's really
welcome.
helpful.
Thank you.
No problem. Here is the phone number. I'll put it on this paper.
Okay.
For the number for my front desk at the clinic.
Okay.
So please feel free to call if you have any more questions.
Great. Thank you.
You're welcome.